because I really like challenge and I really like, high stakes type environments.
Really?
So, yeah, I thrive in that. So, every time I enter it, I'm like, what am I doing? But I find it's like the most incredible feeling afterwards when you really can make that difference.
Welcome to Posture and Purpose, where both healing and community come together. Make sure to subscribe on Apple, Spotify, and YouTube. Let's get into this episode with Dr. Michelle Carr-Frank.
Hello, and welcome to this episode of Posture and Purpose. Today, I have Dr. Paige Kennedy, who is a facial reconstructive plastic surgeon in Lafayette. So welcome, Dr. Kennedy.
Thank you, and thank you so much for having me. I'm excited to be here.
Thank you for being here. I always like to know, how did you get started on this journey into facial reconstructive surgery?
Yeah, so I come from a background with a lot of medical folks in my family, so that was sort of early exposure. And as I decided, through college that I wanted to go to medical school, once I made that decision, as I started learning in school, I was sort of trying to decide between medicine and surgery. That's sort of the first fork in the road, as they say. And I'm a doer. I like immediate results. I'm very hands-on. So I felt like surgery was more of my calling. I had some early mentors who were pretty much telling me that I was made more for a surgical type of specialty, just personality-wise. So as I headed that direction, of course, you go through all the rotations, you get kind of a flavor for everything. Sure. And I really liked that there was a slightly subjective component in plastics and in reconstructive surgery. So, there's the rules and the surgical kind of guides, but then there's scenarios that maybe no one has seen before, or combinations of injuries or things like that aren't necessarily written in the exact specific way. It's not like open heart surgery or something like that where it's step, A, B, C, and that's how we do it. Sometimes you have to get creative.
Right, it's not a cookbook.
That. Exactly. There's a little room for that.
And what really focused your attention on facial reconstruction? You said you had some mentors. Maybe tell us about those mentors and how it led to that specifically.
Yeah. So I have a couple of ear, nose, and throat doctors in my family. I have a first cousin and then my older sister. I shadowed them, of course, going through rotations and trying to delineate what I liked and what I wanted to pursue. And of course, a branch of that is facial plastics. And so I was exposed to that early on. And I loved that the face is such an intimate part of you. It's your identity. It's very emotionally triggering. And so I found that the surgeries that were being performed in that space were just so impactful and so meaningful and challenging, because I really like challenge and I really like, high stakes type environments.
Really?
So, yeah, I thrive in that. So, every time I enter it, I'm like, what am I doing? But I find it's like the most incredible feeling afterwards when you really can make that difference and
see the change that you've made. Was there ever a defining moment in your training that you said, okay, it's not going to be ear, nose, and throat. It's not going to be general surgery. This is what I am meant to do. Was there a defining moment that you can remember?
I got to work with an incredible surgeon. So I went to medical school at Baylor, and I was in the Texas Medical Center, which granted me exposure to, just incredible medicine and a huge scope of it. And I worked with a plastic surgeon there he had been in a horrific accident himself. He was actually wheelchair bound, but he was still operating. And I went to his OR a few times, and just the level of perseverance and the level of attention to detail that he and his team continued to give to people. And I went into his clinic and saw these patients come in afterwards. And, that kind of seeing the journey all the way through, because a lot of times in medical school, you're in the operating room, but you don't necessarily see the follow-up, and you miss the story. Yes. You see just that moment. Yeah. So I think just the luck of being able to see some of those stories, I was like, this is awesome.
Oh, they're so gratifying. Have you noticed through your training or through your experience being a female, has there been any demands? Let me just put it that way, or challenges that you've seen? I know when I was in chiropractic school, there were few and far between as far as females went. Mm-hmm. But how has your experience been?
So I think I'm a little lucky in the timing of things because it was kind of right around the time when I was in medical school where the class was about 50-50, male to female.
Really?
And, of course, the world of surgery, as you sort of get closer and closer to the specialty that I'm in now, the level of female involvement dwindles drastically. So lots in medical school. As you get to surgery, the numbers plummet. As you get to facial plastic surgery, the numbers are really small. So I think I was told really early on, there was a pediatric surgeon when I was a medical student. She was the dean of students named Mary Brandt, and she was super important in my life and was really adamant that I had female mentors. She was like, if you have strong female mentors and you see this playing out and you see people at different stages of their career, because you're in babyhood, and the world is glitter and gold. And then as you kind of have these moments where you start to question if you belong and start to question, if you're making the right choices, you see these people who are further along in that career path and you're, it's pretty clear that it's doable.
And more confident for you.
Definitely.
Have you ever felt underestimated when you said those numbers dwindled and when it really got down to the brass taxes of it all? How did you feel, or did you ever feel underestimated? Maybe you didn't, but
in a sense, yeah, I would say, and there's the comments that happen. People, I'm sure any woman who has been through surgical training will tell you, there has been a time where someone said to them, well, don't you want a family? Or how are you going to balance that? Or,
sure,
is this kind of a selfish little path you're taking? Because tradition tells you that you're going to need to be sort of the matriarch and the head of your house at some point.
Wearing an apron,
just assuming that that's what you want, before we even ask.
Exactly.
And of course, I wanted a family. I came from a big family, and I think that it's doable when you have people who are supporting you. No matter what direction you're coming from, whether you're in the male role, the female role,
exactly,
whatever it is, if you have good support and you're motivated,
you'd be good to go.
You're good to go.
What advice would you give to a young woman that is just starting her journey, either in medical school or general surgery or getting more specialized?
I would say, just go for it. If something seems hard, it's hard for a reason, and you can do it. If you have the wherewithal and the desire and that burn in your soul, you can do it.
Right.
Sometime early in my training too, when I was in medical school, one of my dad's friends is a cardiothoracic surgeon at Texas Heart Institute, and that is an amazing place. For a while, it convinced me I wanted to do cardiothoracic surgery. But he told me, he was like, this sounds so cheesy, but you have one life. Go out there and do some cool stuff. Make the most of it and be scared. When you're scared, it means you're growing.
Exactly. Exactly. And we all know we've been scared, but it's always coming from a good place, usually. And so that's a great story to share. And many people think plastic surgery is only cosmetic, and I know you've probably had these challenges. Can you please explain the difference between the reconstructive side of what you do and how it can deeply affect the quality of a person's life? You know, because I'm sure a lot of listeners are thinking, when I say fun stuff, all the cosmetic stuff that we see on TikTok and social media. But what challenges have you been faced with when it really changes the quality of someone's life?
So there's a few different aspects of the reconstructive side of things. So there's the trauma side, and that is something that I was heavily involved in through training. I trained at a level 1 trauma center in Southside Chicago. We saw a lot of facial trauma, whether it's accidents, gun violence, things like that. So there's that whole component. Then there's the reconstructive component of post some kind of ablative surgery, head and neck cancer surgery, or, skin cancer surgeries, any kind of reconstructive surgery that requires flap placement or, kind of creative tissue rearrangement in order to get back to a sense of normalcy. So I'd say those are kind of the two big branches that I have the most experience in terms of the reconstructive side, and things that people don't really think about quite as much. Unless you've been directly involved in something like that, known someone who had to have a big surgery after a car wreck or, what have you. You don't really think about that side. And that's really where, like I mentioned earlier, the creative aspect comes in. because we're trying to take something
imagine.
that you don't know what it's going to look like. Someone who, one of the biggest cases we did whenever I was in training was someone who had been in a really bad fireworks accident. And so they, lost a ton of soft tissue. They also had some bony fractures in the face. And it came to a point where, it was right in the center face. And how can we make this person look like a person, but also themselves?
Yeah.
And it was, of course, it's over a year-long, multi-stage type of surgery. But at the end, this patient was in the commercials and was so thrilled to just be able to have that sense of normalcy.
And you were a part of that procedure?
Yes, I was a resident, so I was kind of,
But still, to be able to see
Yeah.
the start and the finish. And you mentioned, the reconstructive side of it with trauma. But what about general structure or symmetry or functions that help someone reach confidence, such as speech or breathing, cleft palates, nerve grafting, those types of things?
So those are kind of some of the other branches in the reconstructive realm. And facial nerve reconstruction is a huge aspect of facial plastic surgery. I, during my fellowship, worked with a surgeon named Dr. Erin Smith, who she did a ton of facial nerve surgeries. She had trained with a guy in Beverly Hills named Dr. Azizadeh, who's very well known for facial nerve reconstruction.
Okay.
And that is an entire field of its own.
Okay.
It's kind of one of those things in my world. We say, you don't dabble in certain things. Either your practice really focuses on it or you don't really do much of it. Facial nerve is kind of in that realm, but I'd say with the cleft palate and cleft lip thing you alluded to, that's very much something that is specialty based and also team based. I think that part gets sort of not ignored, but just not discussed as much. You can't do a lot of good cleft work if you don't have the speech therapist with you, the child life therapist. There's a whole crew of people who are involved in cleft palate work. So
Yeah, I would imagine start to finish for sure.
yeah.
And do you see connections between facial structure or jaw alignment, airway health, to help the whole body function better, especially breathing?
Definitely.
I mean,
Yeah.
do you see a lot of that in your practice?
My current day-to-day, not as much, but in my residency, yes, because we did a lot of jaw reconstructions. We did a lot of mandibular advancements, things to sort of help stent open the airway. And then from an internal perspective, which kind of gets away from the facial plastic side of things, more in the ENT realm, but these airway surgeries that, for instance, sleep surgeons are doing, where they're kind of altering the back of the palate, altering the tongue, these things to sort of help people better sleep, better breathing, better speech, all these things.
Sure, with oxygen. And if you don't have a good night's sleep, my goodness, we all know what that feels like.
That's step one.
Yes, exactly. What do you wish more people understood about what you do, about the reconstructive side of what you do?
I think from a reconstructive perspective, I think, we're doing the best we can in order to get people to where they want to be. And usually people who are coming in for reconstructive surgery are not expecting to have ever been there, right? They're not saying, oh, I need a full redo.
Yeah.
They either were born with something that poses difficulty, they were in an accident, they were diagnosed with something that requires treatment. Yeah. And so I think that kind of taking into account that as our starting point for where that patient's mindset is and going from there is very important. And the misunderstood thing is we're just, plastic surgeons. We're just making people have
foo-foo stuff.
Yeah, big lips, pretty cheeks and all that. And
Right.
And of course, there's always the cosmetic component is huge.
Yeah.
But I think the reconstructive component is, this is life-changing work. And this is sometimes, what keeps people going about their happy lives and able to
in a healthy way.
Yeah.
Also, and in your line of work is you brought up working with different specialties. Mm-hmm. How important are those collaborations and co-management for those patients? Do you have a team that you work with locally, either a speech pathology team or some other specialty that you see a lot of co-management?
Yeah, I end up, actually with ENTs a lot, which is funny because I am one, but now I've sort of delved into more,
Specialized,
the specialty. So I do a lot of back and forth with my ENT colleagues in terms of airway, breathing, sinus issues. I get a lot of referrals for functional and sometimes mixed with cosmetic nasal surgery and rhinoplasties.
Okay.
I also work very closely with Mohs surgeons who are doing these kind of bigger excisions in cosmetically sensitive places. The reasoning behind Mohs would be we want to take as little as we can to make sure that we eradicate this skin cancer disease process, but oftentimes that still leaves a defect that needs to be fixed. So they're a common group that we work with. Oculoplastics I work very closely with. I have a lot of referrals back and forth for things along those lines, and dermatologists too.
So for those people listening that don't know what Mohs surgery is, can you explain just briefly what that is?
Mohs surgery is a type of dermatologic surgery that focuses on the removal of skin cancers with the least amount of tissue damage possible. So for instance, if someone had a skin cancer on their nose or on their ear or somewhere where there's not a lot of real estate and not a lot of tissue to give. Right. Traditional surgical approaches would be something called a wide local excision, where there's a kind of a rule book for, you have this type of cancer and it's this size. And so we need to make a margin that is this big. And that's usually significantly bigger than what a Mohs surgeon can accomplish. So a Mohs surgeon is trying to take as little as possible, say around the tip of the nose. We're going to take a small border. And then right then and there, immediately, they're also dermatopathologists. So they can take that specimen, go, put it on a slide, and check the borders and say, oh, we got everything. We don't need to take any more. Or we have a little bit here over at 2 o'clock on this little circle we took. We'll take a little tiny bit extra. Then that patient has, this small little defect rather than, a centimeter of space taken all the way circumferentially around their initial lesion.
And so important. Mentally, do you guys work with or collab with any mental health practitioners, or are there any holistic practitioners you work with for either the mental side of things?
Yeah. I oftentimes, and sometimes this comes into play in the cosmetic realm of things, I like people to have good mental health support. I think it's probably the most important thing before you ever would consider bringing someone to an operating room, because it's not common that I come across this, but there is, body dysmorphic disorder. There are deeper, sometimes less explored reasons that people are seeking changes. And the changes that I'm making oftentimes from the surgical perspective are permanent. Difficult, if at all possible, to reverse. So there's not a direct line of questioning that I kind of go through with people, but when you have a conversation with someone and you take the time in a consult to get to know someone and sort of explore the reasoning behind how they even got in your office, what brought them to call you, I think it's very, very important to have resources for people and to be able to talk about it with them in a way that's an open discussion.
Comfortable for them
of
as
course.
Well. But I'm sure you have your red flags that, maybe we need to dive deeper into this subject. So what are the biggest myths surrounding the facial plastic surgeon or the cosmetic side? What are the biggest myths? I'm sure you're going to say something like social media and how that influences, which I definitely have questions about that. But can you name a celebrity? Why don't we start there? Because I have that question here.
Yeah.
Name a celebrity or two whose outcomes may not have been, let's just say, less than optimal, maybe. Who could you, and what would you have done differently?
That's an extremely difficult question because oftentimes you don't know exactly what they've had done. And I tend to steer clear of the dissect another person's face type of things, because I see a ton of videos on social media, and I think it's the hook gets people watching, right? You're on TikTok, you're on an Instagram reel or something, and you see a doctor and they've got their white coat on and they're in their surgery clinic and they say, let's talk about Kris Jenner. Or, whatever. Right. Let's talk about the Kardashians or whoever it is. And it gets people watching because people just eat that up. They love that.
They do.
And they want to know, what did they have done and who did it? And, why is it so much better than this other person who probably has access to the same resources?
Exactly.
How did it go so differently for them?
Right.
Or, this celebrity just showed up to the red carpet and hasn't been seen on a red carpet in a couple of years. Let's take these two faces side by side and pick apart what's different.
Oh, no, it's terrible.
And I just imagine, I'm like, what if they really didn't have a lot done? Or what if they were really happy with it?
Right.
And then they come across, because these are people. I mean, they probably don't peruse TikTok as often as the average person, but they probably see stuff.
And they are human.
And they're seeing it and they're like, wow, I did get my lips injected and I loved them.
Right.
And then here's everybody saying that I look terrible. So
yes.
I've never made any kind of videos on my own social media account where I pick apart a celebrity face or
that's probably a very classy thing.
I just think, gosh, if that was me, if I was Jennifer Aniston,
right.
What would I want to see when I'm scrolling at night?
But Jennifer Aniston has feelings too, so we should all remember that.
Right.
And what about filters? I know that gives a healthy image of what, not only of what you can do, but what people should look like.
Right.
Beauty standards. How do you guide patients towards a realistic and healthy outcome compared to their expectations?
I like to talk about filters in terms of, photo documentation. I bring that up a lot. I go to my photo room and I take tons of pictures of patients, and it makes me laugh because I'm like thinking, I'm trained to be a doctor. I'm trained to do surgery. I was never trained to be a photographer.
Right.
And here I am, and I've got, a full photo room. And the thing is, I'm taking pictures, and I want them to be consistent, and I'm taking them for the sake of documenting surgery. I'm not taking them to make people look really good.
Right.
So, you've got patients looking at my lights, and they're like, oh, that's probably going to be really bright, or wash me out, or bring that one closer because I look better with close-up light.
Oh, my
I'm like,
goodness.
no. The point is not to glamorize you. You want to be sort of consistent throughout. You want your before and your lighting and your after to be the same. I've been to conferences where I watch amazing surgeons give talks and they show before and afters, and someone will bring up in, the question and answer section of the talk, why is your lighting so different? How do I know that this lady's lower eyelids look better if all of a sudden she's got this beautiful ring light on her in the after photo? And I see that on social media all day long.
Sure.
And, you do your best to just... You consume all this information, and then it puts this
unrealistic
this mindset.
Yes, very unrealistic. Are there any trends? I know we're going to talk about social media so many times today because it has influenced what you do and what so many people do or seek. What are the trends that you're seeing that either concern you or excite you about what you do?
With social media, there's this massive information that people have access to that they didn't used to before. And that's social media, that's forums, that's, threads on the internet in any kind of way. And some of it's misinformation and some of it's good information. And so I've noticed I have patients come in and they are so informed and they're asking me questions that, they would have never asked in the past. They wouldn't have known about, what a certain surgeon's doing in Miami Beach, or
it's out there.
They're reading the papers that used to just be mailed to the offices of the doctors.
Yes,
and they're able to really inform themselves, and then sometimes that can go in the direction of a little bit of misinformation. And it's relatively easy to talk through these things with patients, and for the most part, people are coming to see you because they want to know what you have to say about it. And
right.
I kind of like it because it guides our conversation in certain directions, and it challenges me as I'm going through my recommendations. And say a cosmetic consult, someone wants me to just from head to collarbone tell me exactly what I think, and I'll go through things, and they'll say, well, I think I need a endoscopic brow lift and a deep plane lower face and neck lift with gland reduction. And I'm like,
do they really?
Yeah. And I'm like, that's incredible. That is so cool that you even know that.
You have this information.
And then we can talk about it because I usually you're starting from this person not having any basis for this. And if sometimes they hit the nail on the head, sometimes they really do. And I'm like, perfect. So now we're talking about gland reduction. And you're already coming at me with this level of understanding that allows us to kind of continue the conversation into this pretty advanced place.
Wow. Does that make your job easier or more
It's both.
difficult?
It's both.
Because I can see that.
It can make it more difficult if that's not necessarily the right path for the patient.
Right.
And you sort of talk around, it's an education moment and an education opportunity. And it can also make it harder because patients will get different opinions from different people. And, the world of my world can be overly subjective in that way.
I can't imagine. And how does it feel to help someone? I know we talked about the different procedures you've done during your residency and here in Lafayette. But to see that change both physically and emotionally, that must be so gratifying. I know I can say that over and over again, but to watch someone gain confidence, either aesthetically or whatnot, can you share an experience specifically that you recall that sticks with you?
Oh, yeah. The beautiful thing about Lafayette is that it is big enough for there to be plenty of patients around, but small enough to where I see them on a pretty routine basis.
Okay, yeah.
In and out of the clinic. I have one patient who, when I first met her, I mean, she was in tears. I was just about in tears, just listening to her talk about the way that menopause had affected her. And I mean, from multiple perspectives, but from her facial perspective, she described it as she just woke up melted.
Right.
She's like, I it felt good, and she's showing me pictures through her life, and it was remarkable how much she had changed in a 5-year period. And it was probably heavily influenced by her menopause experience, hormonal changes, things along those lines. She had some life experiences were also high stressors. But just seeing her in that moment, knowing her on that day, and then going through her surgery, her recovery, which is another whole entire emotional journey. And then afterwards, I ran into her at a Christmas party that I went to. And she was initially very private about having had any surgery. Okay. And by the time I'm at this Christmas party, she was so over the moon with just her ability to wear a V-neck, because she was a turtleneck girl before, because she really did not like her neck.
Oh my
And her
gosh.
ability to, wear eye makeup. She couldn't see her lids before. She had heavy, heavy brows, really heavy lids. She, pulled me to the front in front of all of her friends. Is like, this is the girl.
Oh,
this is the one who's the reason
wonderful.
I'm here and I look like this today. And I never tell anyone that I've operated on someone. It's just a HIPAA thing. But I was like, yes, it is me.
That's heartwarming though.
Yeah.
To know that you've made that change. And being that your position and the work that you do is, I would consider high stress. Mm-hmm. How do you focus on your healthy well-being? How do you deal with those things?
I am kind of a master at this point in work-life balance. And I would not say that it goes well every day.
Right.
I'll just say I've been forced to do this because for so long, it was just, especially through training, you can't avoid this. It's constant. I was on call all the time. Our hours were average 15, 16-hour days every day, and I was on most weekends. And so it's really hard to achieve that during that stage of your life. Mm-hmm. And I remember telling myself through training, there's going to be a day where you're all grown up and you have your dream job, and you can structure that how you want. And you can do your best to prioritize yourself, your patients, and find that happy medium. And there are days where I fail miserably. I work the whole day. Next thing I know, it's nighttime and my children are in bed and I just go say goodnight. And those days, that's a failure. Yeah.
It's not a failure. To me. We've all been there. Working moms have been there.
Right.
So don't be so hard on yourself.
Yeah. And then there's the days where, I spend the whole day, I maybe take a day off of work to be involved in something with my son's school or something along those lines. And I wonder about my patients that I'd operated on whose post-op is, going to be the next day instead of that day. And
it's funny how you take those patients home with you. I don't know how much, if they realize that.
I tell my patients all the time, I'm thinking about you a lot. And I'm not in a way that should be weird to you,
right,
just in a way that, I've operated on you within the past, few weeks.
And I care.
And I'm thinking about it. Last time we talked, I know we talked about you had a wedding coming up and you were a little worried that you still had some swelling. And I'm thinking, the wedding is this Saturday. I wonder how her swelling's doing.
Yeah, that means a lot. That makes a good doctor, if you ask me. So that's good to hear. And what does self-care realistically look like to you? Do you do regular massage or do you go on a vacation?
I should.
Anything specifically that is your go-to when you've really had an overwhelming week or month?
Yeah. Well, I have 2 small children and a wonderful husband. So, we love to get outside. We're big Moncus Park fans. So
we love Moncus Park. We're so lucky to have Moncus Park here now.
I know. We say that every time, and I laugh because I'm like, we just sound like a couple of old folks. Every time we walk around, we're like, what was Lafayette before this place?
Right.
But, I did my fellowship in Austin. That was the most recent city I lived in before moving back home. And the outdoor opportunities there are just unmatched. You do have to fight the fact that it's blistering hot sometimes. But it was just incredible. And moving back home, the last thing I remembered was we would go to Girard Park when I was a kid and things like that. But there has been so much change since that time, and there's so many more opportunities to just get outside. And that, for me, that's my medicine. I like to be outside.
Nature.
I like to move. I like to, breathe fresh air, because I spend a lot of time in operating rooms, no windows, and
I need some sunshine.
60 degrees in the operating room, so it's nice to just get out and,
do that.
Be outside.
2 of our sons live in Austin, and when we go to visit, there's, so many things, and I'm sure you know about all of them, but they were recently home for Christmas, and we brought them to Munkus Park, and they're like, this is pretty cool. Is it cool enough for you to move home?
Yeah. How cool.
So we're trying to get them to come back this
There's
way.
pros and cons. I always tell my mom that when I would come home for like Christmas or Thanksgiving and she'd send me on an errand, I'd come back and I'd be like, that was amazing. I just parked right in front of the grocery store and walked in. And she's like, as opposed to what? Like, as opposed to, paying $20 to park in the garage and taking an elevator and getting there. And,
it's like you said, pros and cons.
Being in traffic.
So you were born and raised in Lafayette.
Yes.
Okay.
Well, I was randomly born in Gainesville, Florida, but that's a different story. But my dad was in medical training.
Okay, whole nother podcast.
I moved back as a child.
So, that was my next question. You came back to Lafayette because this was home, basically. Yes. Friends and family were here, and from visiting, you said, "Okay, I think I can do this. I think this is where my heart is."
Yes.
Okay, so where do you see the field of plastic surgery headed in the next 5 to 10 years? To someone from the outside looking in, to me, it looks like it's exploded.
Yeah.
I guess that does have a part on social media and whatnot. But do you feel much of this is due to social media or access? Google, we have such access to so much information now, like we talked about before.
Yeah, I think it's accessibility, and then also there's been this kind of beautiful change happening where people are more accepting of these kind of procedures, and people are talking about it. People are making YouTube channels and making progress TikToks about their surgeries they're undergoing. And I have patients who've been doing these exact things, and I love to see the way that, their comments look and their responses to the comments, and just the massively positive feedback that they're getting. Because this used to be kind of like a hush-hush industry.
Certainly.
And it was, you could have this radical change in the way you look, and people are attributing it to like, oh, I use olive oil in the evenings and I'm just exercising, and somehow, some way
you look 20 years younger.
I've just zipped back through time.
Yeah.
And that was also just so unfair, because then you have people who are consuming that information.
And they feel terrible about themselves.
And they're like, well, I'm doing these things, and why do I look like this? So now that there's this acceptance, that was a huge step. And then, as plastic surgery moves forward, we're talking about it more, and the conversations are generating more research, more investigation, and how can we make surgery easier? How can we make it better for a patient to come and get something done, recover in a super reasonable amount of time, and have that change that they want? It's not going to be overnight. It's anything promised overnight is too good to be true.
A lie.
Just in general. But how can we make it so that we're healing in ways that we never have before? You used to get these procedures be wrapped up and hidden in your house for months. Everyone's got a story of like someone, oh, my neighbor had this done and I didn't see her for a month. And, when I ran into her, she looked crazy, and those kind of things. And, one of my favorite things that's kind of new-ish in my field is this idea of preservation surgery, preservation rhinoplasty. How can we keep some of these structural components of the nose, keep the functional things that make your nose work, but get you a cosmetic change that you seek? Preservation deep plane facelifts is a big forefront right now. And this is how can we achieve these amazing lifts and, long-term, decade-plus long results without having to undergo this extensive dissection that gives people this swelling and these skin changes and, the downtime.
Right.
Nobody wants downtime.
Nobody wants downtime. I had a patient recently, of course, when they're on my exam table, they have to face down. And she had to tell me that, I don't know how to pronounce it correctly.
Like a blepharoplasty?
That.
Yeah.
And she was so embarrassed to tell me. And she was like, Dr. Carr, I can't. And, well, are you uncomfortable? I'm trying to figure out what's happening.
Yeah.
And she finally told me, and I said, it is it's nothing
Yeah.
to be embarrassed of. You know, there's no judgment.
Mm-hmm.
Don't worry about it. She said, well, I did it because of this and that and whatnot. You don't have to explain to me. You know, we'll change around your treatment here, but please don't ever feel, you know, embarrassed or shameful because of doing something that was the best decision for you.
Definitely.
So I know you must see that every single day, though.
Yes.
And if you could leave our listeners today with one message about either self-worth, healing, confidence, what would it be? What would you say if there was one message?
I would say this is your life, your story, and whatever you need to do to position yourself to feel the best in your storyline and your day-to-day life, you prioritize that. For some people, it's, you know, a certain exercise regimen or a certain friend group that they want to, you know, be around a certain frequency. Yeah. For some people, it's, you know, looking in the mirror, I want to feel good. There's always a component of that. We're humans.
We're human.
We look at ourselves. We pick ourselves apart. That's our nature.
Absolutely.
Some more than others, but everyone sees it. And I've been shocked, you know, I'll have a patient who's coming in and maybe brings their husband for the consult, and the husband's over there and doesn't think plastic surgery should even exist. But then, lo and behold, months go by, and all of a sudden he's on my consult schedule because, well, he has always been bothered by his eyelids.
Really?
Or what have you. And
That's great.
It's amazing to see people kind of go through this evolution of, you know, I would feel better and I would be more forward facing and happier to be in photos with my family, in these videos that are going to mean so much to my kids, you know, one day if I'm not around.
Right.
I want to be seen. And if that is something that requires a surgical change, then that's what we do. If it's not, we don't do it.
Yeah.
It's your life and your choice.
Well, I think that's a great message. And how can people best advocate for themselves when they're seeking a facial, either a reconstructive procedure or a cosmetic procedure with you? Mm-hmm. How can they advocate for themselves? What questions should they ask? What are the, I don't know, top 3, top 5?
Yeah, I'd say my most important piece of advice, and I tell everyone that I see in consult this, get multiple opinions. Always get multiple opinions. Okay. I encourage people to see, you know, what you might perceive as like, is that not competition for you as, you know, a surgeon or whatever? I don't think so at all. I want people to have heard from multiple people like myself, with backgrounds like myself, who do the work that I do, what they think is best for them. And then we can talk about it. And at some point, it's not just a surgical fit, it's an emotional fit, because we are about to embark on a deeply emotional journey. It's not the same for everyone, but in general, you come in with trepidation, you're nervous, you're fearful, you're questioning yourself. What am I doing? Should I be doing this? This is totally elective. What if it goes terribly wrong? Right. Everyone has that battle. Hesitation. Then you get through, and as you're healing, you have the what have I done battle, and the now I can't undo it, and the panic sets in as you're swollen, or if you have bruising or these things, and you start to have a social isolation component as well. A lot of my patients are healthy, and they're typically, you know, 50 and above. So to be those two things at once, usually they're very active. They have active social lives. They like to exercise. There's these things that, like you mentioned, go into their mental health. Yes. And all of a sudden they can't do those. They're isolated for a little while. And that really weighs on people. Mm-hmm. You know, I always joke when people start to tell me, you know, I'm not feeling great, I'm stressed out, you know, 1 week post-op, maybe 2 weeks post-op. Like, have you been outside? Mm-hmm. Who have you called? Who have you talked to? So I think that's the most important.
Okay. And I see that in my practice as well. When, you know, people are so active, they want to get to the gym. If they miss one body pump class, they get down on themselves. And I have to talk them through that. It's okay. Let's find something else you can do. You're not going to lose what we've worked on or your stability, anything. But that mental aspect is so important. So, and how can my listeners find you? Where would they find you?
So I am at Hubble Dermatology and Aesthetics here in Lafayette. I have, of course, we have our website. I find nowadays people find people through social media a little more commonly than they find us on the website.
It's weird.
Of course, you know, there's Google, but then
used to be the phone
book. I know, it's so wild. But on social media, I do have an Instagram account. It's Dr. Paige Kennedy. I have a TikTok. I'm slightly less active on there. It's kind of too many balls to juggle.
Right. I know how you do it.
But I'd say Instagram is a great place because I try to post as frequently as I can. And it's me. It's not a social media content manager or anything. That's another thing that I think people don't realize is it's literally me. And so this is not my forte necessarily. And then sometimes
you're doing it all.
Days will pass. I'm like, I forgot to post anything.
Oh
and so,
gosh.
I try to keep stories updated. I try to post before and afters. There, I don't have a ton of patients always who are willing to show pictures, but when I do, I try to show them.
Yeah.
So
I'm sure those are very impactful when you do. And what is your favorite overall surgery to perform?
Ooh, I love facial aging surgery.
Facial
My
aging
favorite
surgery,
is a facelift. I love face and neck lift surgery.
It sounds so funny to hear that.
Because in the cosmetic world, there's essentially facial aging procedures and rhinoplasty, because it kind of exists on like its own island. I love rhinoplasty. It's nuanced. It's difficult in the sense that you have to predict how the nose will age and how it will change and respond to the structural changes you are making. Facial aging surgery is extremely individualized, and everyone has different goals, different history with their face. Maybe they've tried non-surgical interventions, maybe not. Maybe they've had, I don't know, some surgery of some kind in the past, thyroid surgery, jaw surgery, anything along those lines. And everyone's goals are different.
Yep.
You see social media, you'll see a lot of, super chiseled jaw lines, really tight and 90-degree neck angles. Not everyone wants that. Some people want something different. They'll show you pictures from when they were young. I like my small chin. Don't give me a chin implant. I like, this aspect of my jaw.
Chin implants.
Yeah.
Okay.
So, I think it's fun because you're basically, for the majority of my patients, I'm taking them back to a picture of themselves. We're not trying to make you look like someone different. For the most part, that we talked about red flags for a second.
Right.
That sometimes is a red flag. Most people want to look like they did 15, 20 years ago within reason. They're not wanting to look like their teenage self.
Or Jennifer Aniston.
They realize that's kind of... And it would be a little unsettling to be in your 60s and look like your 19-year-old self in the face.
A little strange. Right.
So, we're individualizing surgery in a way that puts you where you see your dream self.
I love that. Great note to end on there. But there's one question, and I know everyone wants to hear this and wants to hear your answer to it. If there was a procedure that you were to suggest for me, what would it be? See, it worked.
I love that question.
I said she's gonna bust out laughing. I said that's gonna be one of our reels.
You
don't
know,
have to answer that.
I love
that.
I love that question the most at a dinner or at an event.
I'm sure they ask you. Oh, I'm sure people ask you. But anyway, okay, one question left. Okay, Dr. Kennedy, how do you maintain your posture while pursuing your purpose in life?
I lean so heavily on my tribe, my community around me. I mentioned my husband and my kids. My husband runs my whole house.
Does he really?
Oh, he does. And he does everything that
he's a great guy then.
I don't have time to do.
Sure.
My mom is here in town. She lives very close to us. She is heavily involved in my children's lives. I'd say, my friend groups coming back home, it's been so wonderful because I'm reconnecting with people that I knew when I was in middle and high school and some elementary school. And, we all have kids now and they're all going to school together at our old school.
How long were you away from Lafayette?
For, I think around 14 years.
Okay, so that's a nice chunk of time.
A while. I left for college and I came back after fellowship, so.
Oh, gosh.
But a lot of my friends have circled back and, we're all home again. And so it's been really nice. So having good social outlets with my friends, amazing family support, those are things that I could not have gotten in another city. And so those have just been huge. And I laugh about the posture thing because I wish you could see some of the videos that I don't post on social media where I'm, in the world's most uncomfortable positions.
Okay, well, you can send those to me and I'll fuss at you.
I see myself in that and I think, wow, that explains a lot about the next day when I'm like, the left side of my neck's feeling a little different.
I need to call Dr. Carr. Well, thank you so much for being here. I really enjoyed our chat. And until next time, sit up straight, stay happy, stay healthy, and stay adjusted.
Thanks for listening to the Posture and Purpose podcast with Dr. Michelle Carr-Frank. Make sure to subscribe on YouTube, Spotify, and Apple Podcasts. Until next time.